Hi, I'm Jennifer Allen reporting for RSNA News. I'm talking with Dr. Laura Bancroft, Chair of the RSNA Annual Meeting Program Planning Committee. We're talking about the trending topics at RSNA 2021 that attendees should look for. Thank you, Dr. Bancroft, for joining me today.
Of course.
What are the research and scientific trends that you are seeing for RSNA 2021?
So RSNA 2021 annual meeting is going to be loaded with world-class research presentations from around the globe. So notable items will be continuation of artificial intelligence, a lot of hot and impactful topics across all the subspecialties. So we're going to have an entire session devoted to AI, as well as highlighted talks all throughout the other scientific sessions. Notable scientific trends also include COVID-related research. So we'll look at the imaging features as well as the international practice changes made in response to the pandemic. Cost effectiveness research, very important, especially related to stroke imaging, prostate biopsy. We're going to see the results of highly coordinated multi-institutional studies as well. Outcomes-based research to see how the patients are doing. We're going to focus that on a lot of different scientific sessions. We're also going to have a non-interpretive scientific session devoted to outcomes and health policy. In addition, we're going to have the diagnostic performance of the various classification systems for tumors. So BI-RADS, lung-RADS, PI-RADS, everything you can imagine to see how we're performing as radiologists, as well as CAD-RADS, so response to adverse cardiac events prediction.
What are your specific scientific recommendations for attendees?
So RSNA offers a wide breadth of educational and scientific courses, as well as electronic educational exhibits. So your CME can really fit your practice. So there's so many, but just a few notable presentations. One in the breast department, survival outcomes using preoperative breast MRI in women with breast cancer younger than 35 years of age. In the GI department, preoperative radiomics model for prognostication in resectable pancreatic adenocarcinoma. For chest, CT findings and patterns of e-cigarette and vaping products using with lung injury. And then in neuro, cost effectiveness of emergency short protocol brain MRI after negative head CT for patients with either mild or unspecific neurologic symptoms. And then head and neck, there's a multi-center study looking at AI to revise the current TIRAD risk stratification system. And then finally with MSK, the diagnostic impact of MR neurography of lumbosacral plexus for failed back surgery syndrome with outcomes analysis. So just a lot of really good practical informational sessions.
You mentioned COVID-19, and there are a lot of sessions that appear in every subspecialty related to COVID-19. Would you recommend that attendees pay special attention to these sessions?
Definitely. So I think all RSNA members and patients throughout the world have been impacted by the COVID pandemic. So there are multiple subspecialty educational courses as well as scientific presentations devoted to the chest, cardiovascular, and vascular findings of this, as well as the clinical rearranging of the practices. In addition, the informatics team is going to present the winner of the COVID-19 lung CT lesion segmentation challenge from 2020. Various RSNA members are going to present their experience with the impact on COVID to their imaging as well as their practice structure. And then finally, RSNA's Medical Imaging and Data Research Center is going to present a multi-society approach to advance research on COVID and other diseases.
For attendees who are participating virtually, what are your best tips for them to feel engaged at RSNA 2021?
So virtual attendees can use the chat function to ask questions from the speakers and experts as we're going along, as well as connect with friends and colleagues all around the globe. So you can watch this live during the meeting, or you can catch up after work or on the weekends up until April 2022.
Great. Thank you, Dr. Bancroft, for your time today.
Okay. Thank you.
For updates and the latest information about RSNA 2021, visit rsna.org/annual-meeting. And as always, you can find more radiology news at rsna.org/news.